Hello, my name is Cindy Reberg, and I am the Communication Director for Wellness Coaches. Joined today by Krista Yoder Latortue. She is a seasoned clinical practitioner and is well placed to discuss how organizations can address the health conditions related to cardiovascular disease. To start, Krista, can you tell us a little bit about yourself?
Sure. So I am a registered dietitian with over 15 years of experience, Masters of Public Health, a certified business analyst. So my expertise really lies at that intersection of public health and employee wellness, and how do we put proven solutions that we know work around chronic condition management. We know it works for individuals. How do we leverage that and apply that across entire employee populations? So that's really my expertise. And as the president of Provider Networks for Wellness Coaches, I oversee our national teams of healthcare providers, whether that's our board certified coaches, our registered dietitians, or our certified diabetes educators.
Great, thank you. So we're going to talk about cardiovascular disease specifically, but before we do that, I kind of want to step back and look at the bigger picture. And there is a term called chronic condition management, which I know cardiovascular disease falls under. Can you tell us a little bit about that big umbrella of chronic condition management and what it entails?
It really is a big umbrella. So chronic disease management or chronic condition management is defined by the Centers for Disease Control and Prevention, or CDC as many of you know it. It's defined as conditions that really last a year or more and require that ongoing medical attention or limit activities of daily living. This could include heart disease, diabetes, and for employers, this can be really important because we know that 6 out of 10 people in the United States does have a chronic disease. So as an employer, we've got to be paying attention to chronic disease management.
So dialing back into cardiovascular disease, and let's talk across the U.S., can you give us some of the stats of the impact of cardiovascular disease as a whole?
Yeah, well, first I'd like to point out that cardiovascular disease is really a term for all types of diseases that affect the heart or the blood vessels. So this might include coronary heart disease, which is clogged arteries at the end of the day. It could include heart attacks, stroke, heart failure, peripheral artery disease. So it's really a term for all those different pieces of cardiovascular disease. So we know that over 800,000 people die of cardiovascular disease every year in the United States. That's 1 in 3 deaths. So, this is a serious, significant group of chronic conditions. Heart disease alone costs the United States about $216 billion a year. And employers, you're going to really want to hear this, $147 billion in lost productivity on the job from premature death as a result of cardiovascular disease.
Wow. Okay. Yeah, that's astonishing. Needless to say, this is a serious topic and might be intimidated for many organizations to say, yeah, we're going to take this on and try to help our employees, our organization with this issue. So before we even try to go down that road, can you give us some guidelines or recommendations for how to address this issue in the workplace?
Sure. So the National Heart, Blood, and Lung Institute actually outlines specific steps that can be taken to address cardiovascular disease. Those include knowing your numbers or knowing your risk, nutrition, physical activity, managing stress, healthy weight, smoking cessation, and controlling diabetes. So any solution for addressing cardiovascular disease needs to kind of include all of those to be effective.
Let's look at this from kind of a wellness coach's standpoint. So if someone signs up and says, okay, I want to address this in my organization, I want to work with wellness coaches. We know that wellness coaches has registered dietitians, wellness coaches, and clinicians. So how does wellness coaches go about pulling this together and implementing this program in an organization?
Yeah, one of the great things about working with wellness coaches is that we are able to provide care across the continuum of care. So whether that's prevention, management, or treatment of a chronic condition like cardiovascular disease, we have the providers and the solutions for every point of that pathway along that continuum. So it's really a comprehensive approach to chronic condition management, which, as I just shared, that's the most effective solution when it comes to cardiovascular disease, is not just having one intervention, it's having a comprehensive multitude of interventions across that continuum and making sure that each employee is receiving the care that they need based off of where they fall in that continuum.
So then based on that, how would you implement this tiered approach in the workplace?
So I mentioned some of those key interventions that we know work, that are identified as proven solutions. Those include knowing your risk. So our biometric screening services can come and help support employees in knowing their numbers. The nutrition that we offer, that's also one of those proven interventions, is offered from our registered dietitians. And then we have our wellness coaches who can support the physical activity, the managing stress, and that's really that prevention tier. Then as we move along the care continuum to managing cardiovascular disease, we have two interventions that are identified as proven interventions by the National Heart and Lung and Blood Institute. Those are healthy weight and smoking cessation. So we have our healthy weight support group, which is facilitated by our board certified obesity and weight management specialist, and offers that expert input along with peer support throughout the year-long program for those really looking to achieve and maintain a healthy weight. For those dealing with smoking cessation, we have our smoking cessation coaches and specialists who are able to support individuals that have that unique need. And then finally, we're talking about cardiovascular disease, but what is proven to be one of the most necessary interventions to control cardiovascular disease is actually to control diabetes. They're linked, they go together. So controlling diabetes for those employees who do have diabetes is one of the best ways to control for and prevent that cardiovascular disease. So we have our certified diabetes care and education specialists who support the employees who do have diabetes, and they receive personalized individual sessions that look at diabetes support and management through an education program.
Okay, so based on everything you're explaining, my mind goes to being in an office and having access to these individuals at my workplace. With the hybrid workforce today, many people might be 2 or 3 hours from the office working remotely. How do we address those employees? Do they have access to these services as well?
You know, one of the things I mentioned in my bio is that my sort of specialty or expertise lies at that intersection of business and personal approach to health. So how do we take these personalized approaches to health that we know are proven to work and extend it across an entire employee population? How do you have population health with individualized approach? What's that balance? Well, our Healthy Ways platform is really our unique solution to finding that balance. So we are able to provide this personalized care that is tailored to where each individual's health risk lies, connects them with the providers that they need based off of their individual health risk, and gives them the right proven interventions that will help move the needle on their individual health, but then also the health of the entire employee population. Not only do the services have to be personalized, the other benefit of the platform is that it gives people access. So access not only to have your providers at your fingertips, but access to be able to interact with them, whether it's in person at the job site for more of that proactive engagement approach, or virtually through a HIPAA compliant system that allows for that face-to-face to occur virtually. And then once again, this is all amplified through the data and technology that Healthy Ways provides, and allows us to draw those really important outcomes and see how the program is working and how we're really moving the needle on those health outcomes.
So let's pretend I'm the leader of an organization and I'm ready to get started. I like the program, but I need to pick the provider. And I go to the internet and there is a ton of information out there. I start Googling and a lot of different great companies come up. Can you, from your perspective and a wellness coach's perspective, give 3 to 5 reasons of why wellness coaches is better and different?
Well, Wellness Coaches really pulls together this unique combination of proven solutions that are provided by the experts in each of those proven solutions. So those impactful providers who each have their expertise in those proven solutions are able to provide care across the continuum of care. And then it's amplified through our Healthy Ways platform, which is our smart technology, which helps to tailor the approach for each individual to their personal needs and give them that personalized approach. You have to have all those pieces to really move the needle on employee health and outcomes at the end of the day. You have to have the right providers, you have to have smart technology, and you have to be using evidence-based solutions for employees to really make significant change.
Is I'm trying to influence others in my organization that this is the way to go. We want to do this. This is a great program for us, a great investment. I'm going to need to prove 2 things. Number 1, return on my investment. And number 2 is value on investment. What I mean by value is I need to ensure that there are outcomes and that my people are going to be healthier, more productive employees based on this investment. So can you give me a couple of examples of companies that have improved population health through a program just like this?
Absolutely. So one that comes to mind specifically is a large health system where they are implementing our services across the care continuum. Employees have access to the wellness coaching, so they're able to get that support around lifestyle modification, whether it's physical activity, stress, sleep, smoking cessation, alcohol moderation, really looking at changing, controlling the lifestyle behaviors that lead to different health outcomes. Additionally, they also offer their employees access to the registered dietitians for nutrition counseling. And so the employees are able to have the support of their wellness coach, to have access to a nutrition expert with their registered dietitian. And then finally, they do also layer on their diabetes educators for the employees as well, so that the segment of the population that is working for them who have diabetes are able to access the diabetes expert as well and get personalized support for their diabetes. So really, by giving their employees access to the experts in each of their respective fields and this comprehensive approach around employee wellness, employees are supported across that care continuum wherever their health risk lies and able to really have this whole team around them. And as a result, we're moving the needle on the outcomes.
Lastly, if I'm an organization, I'm ready to get started and Wellness Coaches is the partner of choice, how do I get in contact to get the ball rolling and start a program?
The best thing is to start at our website, wcusa.com. On there, you're going to find a variety of resources, including white papers and other outcomes. You're going to find our contact information, which we invite you to reach out so we can really have a personal approach to finding out what challenges you're facing and what solutions you're looking for so that we can really support you along your employee wellness journey.